I think most of the vitamins that we need, we should be able to get within our diets. If we have a good, well-balanced diet, lots of fruits, vegetables, natural foods, they provide us with the majority of the vitamins that we need. And it's not just the vitamins, it's actually the minerals also that are very important. Some iron, chromium, selenium, that kind of stuff. Too many vitamins can definitely be detrimental to your health. For example, we talk about calcium. Calcium is one of those things where everybody says you got to have enough calcium for your bones. It is recommended in some of the newer studies that you actually take calcium more from your diet rather than a lot of the supplements that you're taking. The supplementary calcium that you're getting, if you take too much of it, can build up into your body. First of all, it won't get absorbed properly unless it has the proper amount of vitamin D or vitamin K2. Also, then the calcium will then circulate in your body and may actually deposit itself in your arteries and causing more things like heart attacks and strokes. The studies have shown that supplemental calcium has shown an increase in coronary artery calcifications and obviously kidney stones. So you want to try to avoid too much of that. Sometimes when you do look at vitamins, multivitamins, specifically say for example men, they will include more things like saw palmetto, which do promote good prostate health. Vitamins for women will include more calcium in it because women need that for their bones. Some of them do include some hormones. I don't necessarily recommend those, but those would be the certain kind that I would recommend in terms of multivitamins for certain populations. Some people who have certain deficiencies, your physician may want to actually give you more of a certain type of a vitamin to help benefit you for those. If you are concerned about what vitamins should you take, or should you take any at all, at your annual physical when you come in, please discuss that with your physician. They may look at your lab work, they may look at your history, look at your symptoms, and decide what blood work they want to do specifically for you. The history and the exam may guide them towards certain things that you may be deficient at, and then depending on the results, they may recommend particular vitamins to you.